So this is the blueprint that will cover like about 15 questions. The most important thing is USMLE always love to ask what? There is something called Bloom's taxonomy. Do you know about that? You know, when you type Bloom's taxonomy, I want you to go and see that Bloom's taxonomy. It's a simple things. You don't have to be very panic about. You will get an idea where question is asked from. See, this is the Bloom's taxonomy. What happens is when you capture your information, first you capture your information, you memorize the information. Can you see this picture over here? Okay. Just I'll take 2 minutes only on this, and then we will move to. So you can see this. You can whenever you type, you'll get many pages. Okay. So you first what happens? You capture the information. Okay. You capture the information. You link them. Okay. So when you link them, that is called understanding. You know the meaning, and then you try to link them. You associate all the information with each other, and then after you understand, then only you will be able to apply that. So most of the question in USMLE, they ask you from this level application. That is why they don't ask direct pathway. They ask the pathway in relevance to disorder. So what they do, people, the general tendency of the student, they go for just practice. I'm not against practicing question. You must practice question. This is the most important key. You know, practicing question is most important key. Okay, but just practicing question is not useful. What happens? You don't build your information.
Exactly.
You don't understand them, and then directly jump in what? Applying them. When you practice, just go and directly practice question. You just go and then go and apply them. Once you understand the concept, the application will slowly, naturally will come. Okay. When you go for application, then you will apply. So what does understanding means? Understanding means you connect the information, you associate the information based on their meaning.
That's right.
Okay. If you don't understand, you mean what something glycolysis, there's no, you don't know the significance of glycolysis. You don't know the meaning of glycolysis. You don't know the meaning of urea cycle. That is useless. So you need to know what is the meaning, what is the significance of those urea cycle. And then you will connect the information, then you understand. So those small MCQ, one-line MCQ, direct MCQ, that will help you take you from this remembering to understanding. And after you do that, those type of MCQ, what happens in next come application level. Once you understand, so when we talk about application level, everything will be very easy. So what happens now, when I give you question directly USMLE and NBME type question, so when you see the question, you don't really have crossed this level. And when I directly do this question, what happens with you is you don't understand, and then you just try to memorize the answer. You don't understand, and if you don't understand the concept, you are unable to apply. So just that is why you go through this process. Then application, the USMLE asks question from this application level. This is other levels are for us. You know, we need to know how to apply. We need to know. We need to analyze that. We need to evaluate, and we need to create our own. Okay, to present you. So we need to reach this level. But for you, you need to reach this level, application level. So go and see Bloom's taxonomy. This is something you need to know to understand where these questions are asked from. Is that right? So these are the questions I have already shared. Now I told you disorders. Why you NBME? Now I told you Bloom's taxonomy. Why NBME loves to talk about disorders? So this is the reason. Application. Disorder is all about application of your information, because you are ultimately going to be a doctor. So you need to apply those all information. Once you don't understand, really you will not be able to utilize that information very well. Okay. So therefore, the USMLE, you need to understand, then you can apply. USMLE loves to ask things from disorder, they ask question from disorder. They ask question indirectly from the pathways through disorder, so that whether you know how to apply the concept or not, whether you have understood our concept. If you don't understand, then no. If you don't understand, They twist little bit, you will not be able to answer the question. So that is why I always call understanding is the, high concept, high principle, that USMLE looks for. You need to understand things. So let's talk first about osteogenesis. These all disorders, because USMLE and NBME, they ask most of the question from disorders. Okay. So I'm going to put a very high point here, and those high point, you can see they are bold. They are in bold letter. So you can, wherever you see high yield point, they are in bold letter. They are all important, but the high yield, very high yield, they are in bold letters. And you can see they are in bold letters. And I could have put start, so you don't have to worry. This bold letter, consider it as start. Now, osteogenesis imperfecta, it's simplest disorder. These are all disorders of collagen. So 4 type of disorder, you must remember, these are the 4 type of disorder that are related to collagen. These are 4 collagen disorder. First, they can ask direct question, which they will apply. Okay, they will twist the asking style, but they can ask this simple question: which of the following is collagen disorder? This question they can twist other way, and they can simply ask this question: which is collagen disorder? So if you don't know the types of collagen disorder list, and then sometimes they will ask, they will put this Ehlers-Danlos syndrome, and you will not find that. So you need to understand these are all collagen disorder. Ehlers-Danlos syndrome is, there is high flexibility. So student may confuse. There is flexibility of joint, hyperextensibility of joint, but this is not elastin disorder. Because when I was UG, I was confused in this. Ehlers-Danlos syndrome, I confused, okay, it might be because of elastin disorder, because of hyperextensibility. And this is collagen disorder, Ehlers-Danlos syndrome. E4 type 5 is 5th letter. So 5th letter. So classical Ehlers-Danlos syndrome is because of type 5. This is the most, cause is the very important thing. Okay. This column is for cause and pathogenesis. So cause, and this, most of them are autosomal dominant. Okay. Autosomal dominant or X-linked dominant. You can see the Alport last is X-linked dominant. I told you how to remember. I also given you trick about this Alport syndrome. Okay. So you can remember the trick also. So you can, this mirror thing I did, you can put a mirror here. It will be like X. A will be like X. So this is X-linked dominant. Remember that. Type 4 collagen, 4 is for floor. Okay, I forget to bold this. So this is very important point. Cochlear deafness in Alport syndrome. Triad of this thing. Kidney failure, cochlear deafness, and eye abnormality. This triad present in Alport. Alport means always kidney failure. Kidney failure means there will be hematuria. You can understand this Alport. Hematuria. We have done the question. Okay. Hematuria will be there. This is nephritic syndrome. Chronic nephritic in a child. Okay. 2-3 years child will have kidney failure because of Alport syndrome. This is X-linked dominant. Dominant means it will present, it will appear in male and female both. Recessive in male only, mainly male. But dominant, you will see this disorder also in female. Okay. So Alport syndrome, Now Ehlers-Danlos syndrome, the most important or most frequent disorder is because of type 5 collagen. Okay. Type 5 collagen. But there are other disorders. Okay. There are other disorder, that happens. There are other disorder which happens because of what? Other collagen. So collagen, if it is other collagen, it will be odd number collagen. It is a trick. Okay. So Ehlers-Danlos syndrome, you will find an odd number collagen. Okay. Video is recorded. You should go through this lecture again and again. This you can take it as revision for an upcoming NBME also. Okay. And in between also, if you require any revision, just let me know. Within that week, I'm very much pleased to do the revision again. Okay. So see this. This type 5 collagen is the main, and type 3 collagen, it is odd number. I told you type 3 collagen. And this type, when there is defect in collagen or protein, it is autosomal dominant. But there is one Ehlers-Danlos syndrome that also happens because of lysyl hydroxylase deficiency. This is autosomal recessive. You got me?
Yes, sir.
So this is Ehlers-Danlos. All have what? This triad, these three feature they will have.
What is GJH?
GJS, generalized joint hypermobility. J for joint, H for hypermobility. G for generalized joint hypermobility. Okay, when you some small thing if you don't find, you go back to slide and you'll find it there. Okay.
Yeah.
Okay, so this is concise form of slide I have taught you. Okay, so Stickler, I told you Stickler, T for Tuckler, to remember is Tuckler. That is how you can remember easily. It is related type 2 collagen, and type 2 collagen defect. What is the pathogenesis? Type 2 collagen present where? So those organs will be affected. Plus endochondral ossification will also suffer. Is that right?
Yeah.
So as a result of that, type 2 collagen is present in vitreous humor. So that is why eye problem. Okay, there will be problem in eye, glaucoma in eye. Okay, glaucoma is pressure inside eye will increase because of lack of type 2 collagen in the vitreous. Means posterior part of eye has two separation. Anterior part of eye has aqueous and posterior has vitreous. So there will be imbalance of pressure inside the eye, and that will cause glaucoma, juvenile glaucoma, glaucoma in child. It is uncommon. Glaucoma only occurs after 50 years of age. When you see glaucoma in child, this is a Stickler syndrome. And the very important features, you will see the bold, I have made it in bold, arthritis. Arthritis you will see in all Stickler syndrome. There is no Stickler syndrome which does not have. Why arthritis? Because it affects type 2 is present in collagen, and arthritis because of the cartilage is there in the joint end. So that will suffer. Kyphoid scoliosis. These are the micrognathia because of endochondral ossification. These are the presentation you'll see in Stickler syndrome. And osteogenesis imperfecta, a very simple thing you need to remember is brittle. This is a brittle bone disease. You have cornea, dentino abnormality, conductive hearing loss. Here in Alport syndrome, cochlear is sensory hearing loss. Is that right? Hearing loss you will see in Stickler also because it affects endochondral ossification. Okay, so here also, here also, here also. Just understand them. This collagen disorder. The most important thing, most fundamental thing that you should be remembering that these are the disorder that fall under collagen. So generally you forget. Okay, you mix the disorder, and these are the elastin disorder. Okay, how you can see Marfan syndrome is elastin disorder. How is it elastin disorder? But here protein defect is fibrillin. Fibrillin, how do you remember? You can pick this F and capture this F and remember this F for fibrillin. Marfan is for fibrillin. Okay? Is that right?
Yeah.
So I think spelling for Marfan is not F, it's PH, I think. But I have made it F.
Yes, sir.
I made it wrong. Sometimes for your memory, you should make it some wrong. If you make mistake, it will be very present to your memory.
Yeah.
So that is why I made it mistake. Intentionally made F, PH as F. Is that right?
Yes, sir.
So this is how you can remember Marfan is fibrillin. It's easy. PH, it is PH, but I have changed it to F so that you can remember Marfan. You can remember Marfan. Marfan is F. Okay. Now F for fibrillin. So fibrillin protein is absent, but I am telling you this is under this elastin defect. So what happens in fibrillin? You can see what is pathogenesis. It provides stage for elastin. One function of fibrillin is it provides stage for elastin. And second function of fibrillin is transforming growth factor. It regulates transforming growth factor. Okay. So one thing I forgot here to write, okay, in elastin, two features I have written. Third is lens dislocation. Write it, okay, dislocation. So these are you can find these are the features because of elastin deficiency. Rupture of aorta, the patient generally dies because of these reasons of aortic rupture. Okay, and then mitral valve prolapse, these are because of elastin, because elastin protein is very high there. And lens is also held in the position because of elastin. Suspensory ligament, there's elastin associated with that ligament. Okay, so this all happens. Is that right?
Yes.
This all happens because of elastin. So I had asked you a question from Marfan syndrome, and I told you this arachnodactyly, this bony features are because of. So you I'm happy that like 50% of you answered right, but 50% were wrong. I'm also sad for that. Okay, so I want you to tell you again, inform you for that 50% that the Marfan syndrome, this bony presentation, long bone, thin bone, these are because of this TGF overexpression. So if you remember these two things in pathogenesis, TGF, fibrillin controls TGF expression, and it actually help elastin to work. Then you will understand all this presentation. Is that right? Pathology, pathogenesis to presentation. My purpose is to make you understand how you connect presentation with your pathogenesis. Is that right? Yes. Now, so this is a very, very important thing you need to know about Marfan syndrome. Okay. So after Marfan syndrome, the second very important is this. Okay, alpha-1 again. If you see alpha-1 antitrypsin, it is not elastin defect. Here in collagen defect, you can find there is defect in collagen gene, and that has produced disease. But here, neither this have defect in elastin, nor this have defect in elastin, but they are related to elastin. How? I already explained how Marfan is related to elastin. How alpha-1 antitrypsin is related to elastin. See, alpha-1 antitrypsin is actually anti-enzymatic agent. Okay, that it says antitrypsin. You can remember that, see the term. It is anti-enzyme component. It will go and neutralize enzyme. So there is a famous mechanism. I'll tell you, I'll give you an analogy, and it is accepted analogy of alpha-1 antitrypsin. Let me go to the Google. Okay, let me ask one thing. Molecular, you can write in note, molecular mouse trap. Okay, molecular mouse trap. Can you see this? Okay.
Yeah.
No, let me see. Alpha-1 antitrypsin. Alpha antitrypsin as molecular mouse trap. Now it will come. So you can see this. Alpha-1 antitrypsin is a molecular mouse trap. Okay, can you see here? In the comment here, you can see here in the comment, molecular mouse trap. So this analogy will help you remember, okay? Open this picture, okay? You can see here on the bottom, alpha-1 antitrypsin can be considered as a mouse trap. Is that right? It is a molecular mouse trap. How does it do? So, you know, mouse, you put a bait inside the trap, mouse trap. Don't you do that?
Yeah.
When you do put a bait, and that bait, when that mouse went into that the trap, mouse tried to eat that bait and mouse get trapped. So the same way, what happens is antitrypsin. Trypsin, here this is trypsin. And this trypsin is a, like a mouse. It goes and eat protein. You can say it digests protein. So you can call it trypsin or elastin as a mouse. Here elastin is a mouse. Okay. Now, when it go and try to attack a part of peptide here, a loop in the antitrypsin, when it attack, so this loop somehow change conformation and actually trap the active site of the enzyme here. And that is how it will inactivate this trypsin and elastin, this proteolytic enzyme. Is that, did you get that? Did you get me? This is antitrypsin. So you got that? So antitrypsin is called molecular mouse trap. Now understood? Did you understand? What do I mean? So you can see now this alpha-1 antitrypsin, it actually inhibit elastase, macrophage elastase, where it is produced in liver. Okay, and it will act where it go into the bloodstream and go and will act in lungs. Lungs, what is the function? It will trap the elastase. It will neutralize elastase, because this elastase is released from macrophage, because macrophages are active, because lungs is exposed to infections, you know that. And macrophage has to be active there. And macrophage constantly release elastase enzyme. And that elastase will be inhibited by alpha-1 antitrypsin. Did you get me? When this is deficient, what will happen? When this is deficient, the result is microsomal elastase becomes overactive. There is no check in its activity. That is the reason. What happens because of this? There will be emphysema of lungs. You got me?
Yeah. Yes.
So this is a very important concept. That is why I have marked it red. So this is a question, a very important question. Okay. Alpha-1
is taking care of macrophage elastase.
Yeah.
So, I mean, the analogy can be a little bit simpler, sir. Alpha-1 antitrypsin is acting as a mouse trap for macrophage elastase. So mouse is the macrophage elastase. It is kind of catching the macrophage elastase.
Yeah, you're right.
Yeah.
And when there is no mouse trap, what will happen? Yeah. Mouse will go wild.
Macrophage elastase will become overactive when there is mouse will be active. Yeah.
Mouse will go wild.
Macrophage elastase.
Yeah, mouse will go wild. And it will eat up all the elastin that is present in the lungs.
Yeah, that's right.
And what will happen? It will cut all the elastin.
Yeah.
So what will happen? Lungs will collapse. You can see emphysema of lungs. That is the reason. And now, why cirrhosis of liver? Because this protein, it is defective protein gets accumulated in liver. And that is why it will also damage liver. So alpha-1 antitrypsin, lungs has problem, liver has problem. This is a very important feature. Okay, did you get me?
Yes, sir.
So 2 are the elastin disorder and 4 are the these are collagen disorder. Don't forget this lysyl hydroxylase, because this point you will forget this type of point. Okay, type 5 you will remember the lysyl hydroxylase, and type 3 others are also. Lysyl hydroxylase defect also cause. Yes. Okay. Here I forgot to mention one disorder. So I am now remembering. What disorder? 5 you can write is Menkes disease. You can write it. Okay, Menkes disease. Okay, it is because of what? ATP7B, a copper transporter. This is also, and what is the role of copper in collagen synthesis? Collagen cross-link. Okay, collagen cross-link. And there are other functions of copper. What is it? It is part of cytochrome oxidase. Cytochrome oxidase. That is very important for your brain, because brain depends on very high energy. So it is very important for your brain. And what else? Other C is for color of skin. that tyrosinase enzyme contain this. So these three things will be affected in Menkes disease. So brittle bone, this is brittle bone, and this is also called Ehlers-Danlos syndrome type 9. Type 9, okay? So go and read this also, this disorder also, okay? Brittle bone, the steely colored is here, brittle and steely colored here, because of lack of pigment, mental retardation, because of cytochrome oxidase deficiency, mental retardation. Is that right? So this is the application of requirement of copper, where copper is required. So this, why they ask this question? Because they want to ask you synthesis of collagen indirectly through Menkes disease, where copper is required in collagen. Did you get me? Okay, so Menkes disease. I forgot, anyhow, I'm included that also. 5 collagen disorder. Okay, remember this Menkes is not just collagen, it is basically copper. Copper is very important for collagen also. Okay, now, so elastin disorder, you know, Marfan, and we did this 2 elastin and 7 disorder. Okay, now let's talk about urea cycle. So urea cycle, the most important is they love to ask question from OTC. 90% question will come from this, or this is OTC deficiency. So OTC is which enzyme in urea cycle? First, second, third, fourth. There are 5 enzymes in urea cycle. Which enzyme? OTC. Ornithine transcarbamylase. Which number enzyme? First, second, third, fourth, 5. There are 5 choices. Which number enzyme is this? Let's see this here. Urea cycle picture, and then tell me. This is the second number enzyme, don't you see? This is first enzyme, CPS. This is second enzyme. And I gave you brain map. If you don't remember anything, just close your eyes and remember this brain map. Easy thing. Just remember this very thing. Okay. Remember a triangle. OK. Okay, put a box here. Put a box here. At every angle, put a box. And at the bottom, put a box. This is a brain map, simple. You know, and OK is the triangle. Okay, so here is the first step, where ammonia converts into, with ATP, carbon dioxide and ATP, it reacts and converts into CP. And CP reacts with ornithine, O for ornithine. Now this is the first step. First block is the first. This is the second step. Ornithine converts into citrulline. So just close your eyes and remember this triangle. Meditate upon this triangle. Okay, O and K. And then when this is second enzyme. This second enzyme, when it's blocked, what will happen? O and C fusion will not, CP fusion will not happen. I told you carbamoyl phosphate ultimately we will go and change into orotic acid. Do you remember that? Because carbamoyl phosphate is common substrate for urea and pyrimidine synthesis. The first reaction of pyrimidine synthesis is what? CPS2.
Yeah.
And that will produce carbamoyl phosphate. Do you recall that?
Yes. Yes.
Yeah. The same carbon. So the pathway does not require. And the second enzyme, that aspartate transcarbamylase, will use that carbamoyl phosphate from urea cycle. If this enzyme is not there, which enzyme? OTC. So what will happen? Orotic acid is high and citrulline will be low, right? Right? So remember, this is the most important disorder you need to remember. Yeah. OTC deficiency. Okay. So here, what I told you, and in this box, you write aspartate. Aspartate will go and join citrate to form arginosuccinate. Yeah. Okay. Here, this is, what is that? Arginosuccinate. Here, fumarate is released.
That's right.
This at this box. And what else? Here, arginine will convert into ornithine. What will release? Urea. So this easy thing, you can remember this brain map easily. And then brain map will help you remember everything.
Yes, sir.
Okay. So just remember this urea cycle, the most important urea cycle disorder is OTC, ornithine transcarbamylase. And you can use this same OTC as mnemonics also. O for orotic acid. Orotic acid is high, citrulline is low. Wherever in question you find, okay, question will mention that the citrulline is very, very low. That is a clue. That is a clue that this disorder will be OTC. But along with low citrulline, there has to be high orotic acid. Then it is a which disorder? See, you don't remember, you don't memorize mnemonics also. Aisha, this is review class. Yeah. Fortune, this is review class. Yes? Will you be able to remember this OTC?
Yes.
Shiva?
Yes, sir. Yeah. I mean, I did this quite well, kind of like, but I didn't revise in the last couple of days.
Just remember this right now, only memorize. Even if you don't revise, memorize it right now.
Yeah.
OTC, I told you about, I gave you this, who I have thought so much.
Yeah.
So that you will not have to work too much.
No, definitely, sir.
So I have given you memory tactics, how to memorize. Just use them and remember this. This is a very, very important disorder. OTC deficiency, high orotic acid plus trace citrulline.
Yeah.
OTCs, TC for trace citrulline. Is that right?
Yeah.
O for orotic acid. Now, second disorder I want to remember you is like second is ASS. Okay, you have to have overview of all, but you have to memorize. You must not forget. You must consider this as a breath.
Yeah.
And whenever, even if you are in dream, you must not make mistake upon this. You got me? So this second disorder I told you, C for citrulline, and the double S. Phonetically, C is for phonetically it is similar to S. So double S means double citrulline. You can remember. So citrulline is very high. In ASS deficiency, what does ASS means? Go and memorize the name of enzyme of urea cycle. Only 5 steps, and you have to memorize them. And it is not that difficult to memorize urea cycle. So first enzyme is what? CPS. Second enzyme is what? OTC. You see, you did not memorize, you have not gone through biochemistry. You ignore biochemistry. That is the problem. That is why I'm getting this problem. So no, CPS, okay, most of you ignore biochemistry. Okay, CPS, OTC. And then third, I have given you, trick to, so that if you try to recall a little bit, if you work a little bit, you will memorize many things. ASS is the third enzyme. Fourth enzyme, just remove one S, will become fourth enzyme. Fifth enzyme, remove again S, it becomes fifth enzyme. It's simple to, it's easy to remember.
Yes.
5 enzyme. So ASS is arginosuccinate synthase.
Yes, that's right. It is
converted. So this arginosuccinate synthase is third enzyme. When it is deficient, then it will cause citrullinemia. Very important 2 disorder you must remember. Okay. So 90 to 95 question will come from this disorder. Remember that. Yes, another thing, ASS deficiency is type 1 citrullinemia. Remember that. Okay, and this is also very, very important point. Arginine is high only in arginase deficiency. In other urea cycle defect, arginine is low. Okay, so this is also very important point. Okay, we did urea cycle. Okay, this is orotic acid, intermediate of pyrimidine synthesis. Go over it, memorize and understand them very well. Because if you don't understand, it will not work for USML. Now, disorders of nucleotide metabolism. I have done it many times. Now, there are 5 disorders you must remember. They belong to nucleotide disorder. They are disorder of nucleotide metabolism. But first, you have to remember that these are the disorder. They are disorder of nucleotide metabolism.
Yeah.
Okay, you have to recognize them. The problem is sometimes you don't recognize them as disorders of disorders of nucleotide metabolism. You have to recognize first that they are the disorders of nucleotide, and they have completely different picture. They all are different from each other. Okay, see SCID. Let's start from SCID. If you see SCID, it is called severe combined immunodeficiency. The name is itself a self-explanatory for its presentation. Immunodeficiency. You can see whenever you see immunodeficiency, there will be infection. Infection where? The exposed area. What are the exposed area? Your GIT is exposed area to the external environment. What is the other exposed area? Your lungs is exposed area that is exposed to external environment. These are infection of this part. Okay, lungs, GIT, and skin. These will be infected first. So there will be diarrhea, pneumonia because of lungs infection, pneumonia, and the GI infection, diarrhea. Skin infection, skin rashes. Is that right? Namidek?
Yeah.
Is that right?
Yeah. Yes, sir.
Yeah. Mitchell? Some silent people, please. Sometimes we. Okay.
Enzyme is.
Blessing came and. Okay. John is there. John, you need to speak a little bit. Mitchell, you need to speak. Switch on your camera, please. That is why. So this is lack of professionality. If there is a protocol to switch on your camera, you must not switch off the camera. John, this is also again lack of professionality. Somebody has. If there is a protocol, so you have to follow that. Okay, so SCID means severe combined immunodeficiency. There is immunodeficiency. Severe and combined means you have both T cell and B cell and T cell are deficient. These are the part bold letter you will find in question. These are the clue you will find in question. Okay, frequent infection or exposed area. Okay, they will write differently, but these are the area: lungs, skin, and GI. Infection will be there, and they both B and T cells are deficient. And T cell is mature. T cell mature in thymus, so there will be thymus will also be small because T cell is not formed in there. So thymus will be small. Rather than aplasia, replace the term with a small thymus or dysplastic thymus. Small thymus will be there. So these are the features you will find in SCID. And this is because of deficiency. There are many reasons of 4 or 5 reasons for SCID. But for us, the most important is this. Second most important though. Anyway, yeah. This is my ADA deficiency. And see, ADA deficiency, what it will cause? ADA deficiency will cause, it is a catabolic enzyme that will catabolize, okay, ATP or deoxy ATP. So when it is happens, so there will be accumulation of deoxy ATP. And deoxy ATP, you go and see RNR, ribonucleotide reductase. I have told that this is deoxy ATP is inhibitor of RNR. Okay, so when RNR is inhibited, there will be no production of DNTP. When there is no production of DNTP, DNA synthesis will suffer. And that leads to, when DNA synthesis suffers, so multiplication of B cell and T cell will suffer. That will lead to SCID. So these are all important points, though I have not marked them. Okay, so I should mark them all. These are all MCQs, individual and MCQ. Making it bold. Okay. Okay, you can write it SCID. Okay, T cell and B cell DNA synthesis decreased DNA synthesis in T cell and B cell. In other places also in T and B cell. Is that right?
Yeah.
So that is why combined, name is self-explanatory. If you remember name, the full form nicely, you will not forget. You will only have to remember this ADA pathogenesis. The pathogenesis is a very important part of this disorder. Remember all this point, 5 point. They asked all this 5 point in MCQ. Okay, so let's come to gout, and then we will move ahead. So gout, it's very easy. So it happens because of either high purine synthesis or high catabolism of purine. Is that right?
Yeah. I mean,
So
basically, it is PRPP.
Yeah. What is gout? You know, you have to know what is gout.
Uric acid, high amount of uric acid.
Yeah, gout, or you can say the disorder hyperuric acidemia. So you can include both together. Hyperuric. So uric acid is high. Why uric acid is high? Uric acid is catabolite product of. You need to know that. You need to have that information.
Yeah.
It is a catabolite product of purine.
That's right.
Okay. So that purine, when catabolism of that purine increases or synthesis of purine increases, then what will happen? There will be more catabolism. Or that is why then I have given you a document also. You might have gone through that. So that will cause hyperuric acidemia for biochemistry. For biochemistry, so this is also very important. Purine synthesis, it increases because of high purine synthesis, the gout will happen. This is relevant to biochemistry. There is one question. I'll share you the question, only one question I'll share you. So you can see this in this question, you can see here what is mentioned, the PRPP synthase, the first enzyme, gene, that result in, there is mutation in this enzyme, gene, okay? And that led to its increase in Vmax, okay? When Vmax is increased, very high, maximum velocity is very high, what happened?
You'll have more PRPP.
More production of what? More PRPP and more production of purine.
Purine, okay.
And when more production of purine means more uric acid. Is that right?
That's right, that's right. So joints
okay.
are...
Mitchell?
Yeah.
Is that right?
Yeah.
Yeah.
Okay. So this is, and that is why not only PRPP, this is just one question, you have to, this is how they ask, actually, you need to recognize what are the enzymes of purine synthesis. If you don't recognize the enzymes of purine synthesis, they directly, indirectly want to know that if you know or not the enzyme of purine synthesis, if you know or not. So they indirectly want to check these two enzymes I wanted you to memorize.
Yeah.
If
amylotransferase and
if I give you a question related to amylotransferase, I replace this with amylotransferase, okay?
Mm-hmm.
And I'll say, okay, Vmax is very high, okay, and very active. Enzyme somehow become very, very active. So what disorder you will get? Same thing, isn't that right? So you have to remember, any enzyme mutated in purine synthetic pathway, and like it gains function, becomes very active, that will cause what? That will cause this hyperuric and gout.
Yeah.
Okay. And then what else here? Second enzyme is also related to gout. There is also gout inside, juvenile gout, juvenile hyperuric acidemia. Here what will happen? The enzyme is deficient. What enzyme is deficient? The salvage pathway enzyme is deficient. And this salvage pathway will, activate purine synthesis, purine synthesis. How? This is the reason you can find it. When salvage pathway enzyme is deficient, it will not be able to form AMP quickly, because salvage pathway form AMP and GMP quickly from base. Is that right?
That's right.
So there will be less amount of this. When there is less amount of less feedback. When less bit feedback, there will be more PRPP, and that will cause uric acid.
Here it is a feedback mechanism.
Lack of feedback mechanism. Loss in feedback mechanism. So this question also, this is also very important. They ask question from this. Again, I forgot to highlight this. Let me again highlight this. These are all important things. I only highlighted purine. This pathogenesis of Lesch-Nyhan syndrome, they ask indirectly. They sometimes they ask, why does this happen? High uric acid. They will ask because of lack of feedback. This is a very unique thing. They will love to know because because of lack of feedback. So this question this point they sometimes ask. So you need to know lack of feedback produced PRPP. Okay, this and this. So you know Lesch-Nyhan syndrome, why it happened. So what is the problem in Lesch-Nyhan syndrome? Lesch-Nyhan syndrome has 3 features. You know that? I told you. Do you remember that three features? Presentation. One is chorea ethitoid movement.
Yeah.
Chorea ethitoid movement.
Yeah. You showed actually this movement.
Yeah, movement. Yeah, movement. And then second is what? Self-mutilation.
Yes, the child will kind of try to eat the...
Yeah, mutilation. And what else? There will be diaper will be full with uric acid crystal.
Uric acid crystals, yes.
So these are the things you will see in this disorder. Okay, you got me?
Yes.
So Lesch-Nyhan syndrome. Now orotic aciduria. See, orotic aciduria, first you have to recognize, you don't recognize that orotic aciduria it is because of pyrimidine synthetic pathway defect. Okay, there are 2 types of orotic aciduria. The generally asked orotic aciduria, one is related to OTC, we discussed here. OTC, here also orotic aciduria. Other orotic aciduria is related to pyrimidine synthesis pathway.
Yeah.
Pyrimidine synthetic pathway, you know, this enzyme is defective. UMPS enzyme. And when this enzyme, what does this enzyme do? This enzyme converts orotic acid into UMP. It's already there. Okay. This enzyme converts orotic acid into UMP.
Yeah. Mm-hmm.
You got me?
Yeah.
So this enzyme converts orotic acid into UMP.
Yeah.
When this enzyme is not there, orotic acid will get stuck and orotic acid will be high.
Yeah.
So UMPS, just go and see. UMPS has 2 components. One component OPRT, you can write also OPRT, OPRTS, and second component is OMP decarboxylase. So T2 enzyme activity it has got inside. So UMPS enzyme deficiency will cause what? Orotic aciduria. And what is, these are the presentation, high orotic aciduria, that in children. And because of lack in this pyrimidine synthesis, this thymine will not be formed and it will cause megaloblastic anemia. Which type of megaloblastic anemia? That will be refractory to treatment of, even if you give folate and vitamin B12, it will not get corrected. So these 2 things you have to see in orotic, this type of orotic aciduria. That is because of pyrimidine synthetic defect. Is that right? 2 type of thing. First is high orotic acid and second is megaloblastic anemia refractory to treatment of folate and vitamin B. Okay?
Yeah.
Now when we talk about megaloblastic anemia, let's talk about the normal megaloblastic anemia, pathogenesis also. The pathogenesis
refractory means it is not kind of helping. That's what it means, right? It is not helping. The treatment is not helping. The folate treatment is not helping.
Not helping. Folate treatment is not helping.
Yeah.
You're right. Folate treatment, folate and vitamin B12, even if you give them together, it will not help. So megaloblastic anemia, that acquired type of megaloblastic anemia, you can say acquired type of. So you can acquire megaloblastic anemia because of folate deficiency or vitamin B12 deficiency. Generally, the question they ask, the patient is being treated with what? Methotrexate.
Yeah.
The patient is being treated with methotrexate. You know, what is methotrexate? They are asking. So what is they are asking in one line many things. Yeah. You need to have information that methotrexate is inhibitor of folate. And that is why it will cause folate deficiency. Okay. So when this methotrexate treatment is done, so the patient will have which problem? Megaloblastic anemia.
Yeah.
Okay. Which deficiency? Folate deficiency.
Yeah.
How do you correct this? By giving high folate.
Yeah.
What is the pathogenesis? So it will inhibit this enzyme. You got me?
Yes, that's right. That's right, sir.
So this is how they ask question.
Yeah.
Application based question.
Yeah.
And then they can ask, okay, vitamin B12 deficiency. And they have megaloblastic anemia. Why? Because of folate trap. Even the folate is there, the folate will not be activated. Folate is activated by vitamin B12.
Oh.
So that is trap. Folate get trapped. These are the very, very key point I have mentioned here. You go and revise it and many times understand them. Okay. So you can go over this video again and again, and you understand all this disorder nicely. Okay. So we have seen how many disorders? You can see 5 to 7, 7 plus 5, 12.
Yeah.
12 plus 2, 14 disorders. You can see it, 14 disorders we have seen, the whole thing. Now these are the drugs. I told you the drugs, how they ask question from methotrexate. Do you remember how they ask question from methotrexate? Here. Here you forgot. I told you how they ask. Now just go over this drug. Understand this drug. Bolded drug. The drug in bold later. So 6-mercaptopurine inhibits which pathway? Is purine synthesis. Okay. Yeah. And then hydroxyurea will inhibit ribonucleotide reductase. Okay. And now methotrexate will inhibit what? So these 3 drugs I want you to memorize. The 4. Fluorouracil. These 4 drugs I want you to remember. Will you be able to remember this 4 drugs?
Yes, sir.
6-mercaptopurine, hydroxyurea, fluorouracil, and then methotrexate. They inhibit which enzyme, which pathway? Okay?
Yeah.
Now, so rate limiting step always becomes very, very important. So in purine synthesis, what are the rate limiting steps? These are the rate limiting steps. Okay. In pyrimidine synthesis, these are the rate urea cycle. This is the rate limit. And these are the activator and inhibitor. Go and read this. Okay. Okay. Yeah. So these are the questions that I want you to go. Okay. So our time is over, but you can go over this question. So you can see this question. After protein is synthesized, the protein is folded into tertiary and quaternary structure. And I did not add a quaternary. It should be quaternary. Tertiary and quaternary structure by which? By what? Protein folding is job of which enzyme or protein? It is job of chaperone.
That's right.
You have to remember that. It's a job of chaperone. Yeah. It's the protein called chaperone. Why chaperone are called heat shock protein? Because it is not, heat is one type of stress. Because of stress, the chaperone because of stress, the chaperone concentration inside cell increases. That is what they are called heat shock protein. You got me?
Yeah.
In short, it is called HSP. So remember this concept. So intracellular misfolded protein is degraded by when protein is not folded nicely.
Yeah.
So this misfolded protein will be degraded by what? This is degraded by, do you remember? I told you UPS, ubiquitin proteasome system. And then ubiquitin chaperone term. This term I wanted you to remember. Proteasome will destroy. Okay. This proteasome will destroy the protein that are misfolded in the cell. So cell does not want misfolded protein. You know, misfolded protein will cause many disorders. Don't you know? Alzheimer's disease, we have done that TBL on that. So then cell does not want misfolded proteins. That is why proteasome will degrade, destroy that protein. So which of the following post-translational modification occur to misfolded protein? At ubiquitin addition. After ubiquitin addition, then this will be. Maybe you don't have key for these questions. Just write the key. Okay. Here, chaperone is the answer.
Yeah.
You know this?
Uh-huh.
B is the answer. Here also B. Here C is the answer. Now you have answer for this because I have got from this your slide only. So the message conveys primary sequence is very important. That will guide everything. Now here type of bond, you go over this type of bond is what? So which type of, this? Why proline is low? This is also very important question. Low and absent is alpha helix. So go and see the slide. Okay. So this secondary bond and this prion disease is basically misfolding happens because of there will be a hydrogen bond will be broken from alpha helix and that protein will conform into beta sheet. Alpha helix generally changes into beta sheet. Okay, in all prion disease, the main folding is alpha helix that changes into beta sheet. So you can see here, these are the prion disease. Okay, so they will. This is a very important disorder. Okay, secondary structure of protein are alpha helix and beta sheet, and are stabilized by this answer. I have already given. Just go over this answer and see this transmembrane protein. They are anchored to the membrane by hydrophobic interaction. You have to remember hydrophobic. This is also a question. You can see this. So hemoglobin alpha, this myoglobin has which secondary structure? They have all alpha helix. They have all alpha. There's no beta sheet. All alpha helix. Go and see the structure in class. You'll find it. So what is the difference between hemoglobin and myoglobin? Hemoglobin is what?
Myoglobin is single. Single? Myoglobin is single and hemoglobin is
So tertiary, what does tertiary protein means? A quaternary tertiary protein has single. It is monomeric. A quaternary is multimeric. So this is a very important question. They ask question from this. Okay. Quaternary is multimeric. You have to remember. Tertiary is monomeric. Now, what is the role of extracellular lysine oxidation? You have to remember lysine oxidation, that disorder related to that we have talked. Lysyl oxide. That disorder is copper involved disorder, Menkes disease. Okay, this concept you can utilize in Menkes disease. Go and see. So these are the things you must abandon amino acid in collagen. Why does this amino acid help structure of collagen? Because small amino acid will help twisting that. Okay, this is very flexible. That is why it will help sharp twist in that. And it will help other amino acid accumulate other amino acid. When in osteogenesis imperfecta, this glycine is replaced by bulkier other amino acid. That is why the pattern on the whole collagen molecule is destroyed.